give him supplemental oxygen.
Yeah.
I'm just cleaning it. I'm not sucking any oxygen. When I was suctioning, I was literally sucking some oxygen away, but I'm just cleaning. Like students always say, I'm gonna hyperoxygenate before I clean. No, you're not. You don't need to.
And there was a good question while you were going in the back room, Mary, that like if somebody's ordered every 2 hours, you get a brand new little kit every 2 hours.
Yeah, every 2 hours, yeah. So let me tell you, as many of us that there are instructors are ways to do trach cleaning. I'm going to show you my way.
And as long as you don't break sterile technique and skills testing.
And remember, his goobers are his goobers, so that's okay. What I can't do is touch everything else and then clean his trach. I'm gonna take this pillow away. Do you mind, Mr. Gray? No, he doesn't. Okay. I like to put this down. They cough a lot. So I'm just gonna show you my way. This is the way I think you guys learn the best. So this is why I demonstrate it this way. So I hope your kit is like that. I brought an extra pair of sterile gloves. Actually, I don't even want these on yet. I wash my hands. You don't need an order for trach care. It's part of the procedure of someone having a trach. We generally do it at least once a day. Some people you have to do twice a day. Just depends on your facility policy, but definitely you should be doing it at least once a day. I would, obviously this would be covered and I would peel the top open, right? Just like any sterile tray, just peel the top open. This one has sterile gloves right on top, but you're gonna see I brought another pair of sterile gloves because I use these as my clean gloves, and I will show you. This is a towel that really is meant to put over the patient, but I'm gonna use it for my sterile field. You're gonna see why in a minute. So I'm just touching the outside, just the part that's gonna touch the table. Those are all my supplies. I'm gonna dump them out onto my sterile field. Oops, I don't want it flying. I would get a new one, right? This was a little closer, but just say, dumped all that out to there. So, oh dear. I can't use this, there's a hole in it. All right, you guys, I'm gonna do it. I'm gonna have to fake do this. So, depending on your facility policy, some facilities just use saline to clean. Some use a mix of saline and peroxide. I'm gonna show you a mix of saline and peroxide. So, there's 3 chambers in here. I'm gonna put half saline, half peroxide in this compartment right here, and then saline and saline in here. But this has a hole in it, so I'm gonna fake it. So like I said, I would put some saline in here. Saline in here. I'm not a big fan of this kit. I don't like it. I wish we had different ones. And then I'm gonna put in the big compartment where I put some saline, I'm gonna put some peroxide, just approximately half and half. That's gonna be to clean my inner cannula. All right, I'm gonna just use these as clean gloves. I could do this another way, but I think when you're first learning, this is like just the easiest way to do it. So remember, like that's my sterile field. I have a face shield on too. All right, Mr. Gray, I'm just gonna take this inner, so I'm gonna take the inner cannula out. So you guys, you have to get up close. So the inner cannula and the outer cannula lock in place. So you'll see on the inner cannula the word lock, and you'll see a dot. When the dot on the inner cannula lines up with the dot on the outer cannula, then it's locked in place. And this actually has a little arrow on it too to tell you which way to turn it so that it's locked. I'm gonna turn it the opposite way to unlock it and slide it out. It's not hard, you just turn it and you'll feel it give in your hand, and they're gonna cough, I guarantee you. And then you just turn it. Well, of course, on the mannequin. So I just have clean gloves on now, remember that. This is yucky. So I'm gonna put this in my saline peroxide mixture, okay? And I like that to soak, so that's gonna soak. Imagine this, secretions all over it. Just take your clean gloves and take this off. Now I'm gonna take these out. Put that back. That's soaking. Now I'm gonna move to the sterile piece. You could also do this with one dirty hand, one sterile hand, but I don't know.
It's safer.
I feel like after teaching it all these years, and until you get super comfortable with it, I think this is a better way to
It's safer to do that.
begin. And the patient's fine. They don't need the inner cannula to breathe. So people have trachs tend to have a lot of secretions, and the inner cannula kind of catches those secretions. That's why we take it out and clean it, or we take it out and throw it away. It's a way to, if you think about it, kind of catch those secretions so they don't get mucus plugs and stuff like that. And there are patients that don't have an inner cannula. These gloves are so much nicer. Okay, I have a brush just to show you some pipe cleaners. This is all sterile. We do not use these trach ties anymore. We have Velcro straps now, which is nice. This is just some extra gauze. A lot of extra gauze. I'm gonna put these in my saline. My drain sponge. Okay. So I took the cotton tip swabs and I put them just in the saline, not in the peroxide mixture. We never use peroxide on the skin, just saline on the skin. So what I'm gonna do with these tiny little swabs is I'm gonna clean. So this is gonna be a dirty hand now. So I'm just cleaning the trach collar right here. You get not in the trach. You're not sticking anything inside the cannula, nothing. You're just cleaning this trach collar right here, and it gets a lot of secretions on it, you guys. You just really gotta scrub it. Sometimes I try really carefully. Sometimes you need to. These gloves are too big. I dip a little gauze in the saline and I try to wipe the secretions that way, just to get them off, because sometimes they get really dry. Again, I'm gonna lift up the collar and I wanna get the skin around the stoma. Get secretions under there, it gets crusty, so clean all that. Use, I try to wrap like a gauze around my finger and clean under there. And I know you guys are gonna be like, but when your finger touched his skin, but remember, I'm not introducing anything new. Like what's on his skin is already part of his, body. I'm just trying to get rid of those secretions that have been sitting there. If you need to, you could dry it with the gauze. My dirty hand, sterile hand. I'm gonna reach in here and I'm gonna grab just the white part of the inner cannula. Don't touch the part that's gonna go in the patient. Touch the outer part. I'm gonna take my brush. I'm gonna clean it. It's not gonna be like this. Like this is clean. In real life, there's a lot of secretions in this inner cannula. You gotta get them out. They're sticky. You gotta scrub this. And then why I don't like this 2 separate compartments is because we had this in saline, we have to do our best to try to rinse this. You don't really want peroxide in the patient, right? I don't know who designed this, I always say this, but it wasn't a nurse. Rinse that in the pipe cleaner. So this is my sterile hand. This is the hand that's always reaching in my sterile field, if that helps you think of it that way. I'm gonna dry this thing with my pipe cleaners.
And you have to dry it really good, because if you put it back in there wet, it's gonna put it into a coughing fit. So really dry it good.
And if you've got any visible droplets on there, get those visible droplets off. All right, so I'm a righty. I have to switch hands at this point, but that's okay because this white part is never gonna be quote unquote sterile, right? That's the part that's always external to the patient. So, gotta switch hands. This was my sterile hand anyway.
Right, and it was your sterile hand. And you're not gonna use it for anything sterile after this.
Nope. I'm telling you guys, it goes in much easier on a person. I don't struggle like this on a person. The mannequin's giving me a little challenge. Then you lock it in place. Make sure it's locked in place. And then you're not sterile anymore, like Kim said. You just put the little pants on, you know, underneath. I'm telling you, they're gonna cough, you guys. Every time you stimulate this area, they cough. So you're changing that. You can change this gauze anytime you want. Like you don't have to wait and just change it once a shift. You can change it every time you go in the room. You don't need sterile gloves just to change the gauze. Like who wants, think about it, like who wants a wet, sometimes stinky gauze on their chin all day long? Put their oxygen back.
And like Mary said, sometimes in the hospital now,
These
you'll see disposable inner cannulas.
Yeah.
So you would do that first part where she cleans, you know,
I have it if you want to see.
clean around, but then you just take the inner cannula out, throw it in the garbage and put it in the
Here, I'm going to show you. I have some. It literally clips in and out. It's so much
So
easier.
then you don't have to use the peroxide and saline or anything.
We just want to teach the hard way because I feel like
And I got the help with the tree care.
And it was disposable, right?
Yep.
But like when they go home, a lot of times they don't use disposable ones, so we have to kind of teach them how to clean it for home. So you do still have to know how to do it. But
First of all, let me say this as well. The ties that hold the trach collar in, you never change them by yourself. You always need 2 people because you need someone to hold the trach collar and the trach in place while the other person changes the straps.
The Velcro.
Yeah,
'Cause there's
because
nothing
if you have one
really in there.
person and you let go of the phalange, the trach collar, and they cough, I'm not kidding you. They're gonna cough that trach right out on you.
There's
2
nothing
people
else
to
holding
change.
it there.
You don't have to change the trach strap in skills testing. Like if they're Velcro straps, you can cut them to size if you need to. They literally come in a box like this. 2 people to change.
And you
trach
don't
ties.
change them every time. you
Nope,
break
just
it.
when they're really gross, we change them. So this is so easy, you guys. So it is sterile. So you just open the cannula and it just clips in and out. It's got 2 little clips on it, and you squeeze it and you slide it in, and then when you want to take it out and throw it away, just squeeze the clips, take it out and throw it away. Put a new one in. So easy.
So, is the trach care and the suctioning gonna be 2 separate skills?
Yes.
Okay.
Yeah, so you either get suction or
Or the care.
So are these strictly nurses' jobs or can respiratory do?
Respiratory can do it.
But it's
Both
a
of them?
nursing responsibility.
Right.
The nurse has
Respiratory
to-
sometimes not. Yeah, respiratory will do it if you're lucky.
They don't generally do trach care, do they?
Yeah, they do.
Oh, they do?
I get happy when they'll be like, oh, respiratory just did their trach care. It's like, yeah. It depends on respiratory too and how busy they are. But like Kim said, it's nursing's responsibility. It's not one of those things where you can't say, well, respiratory will do it as a favor for you. Or sometimes, generally, in my experience, almost everyone in the hospital that has a trach, respiratory comes and sees them. Just because that's just the routine. But they may just come see them for 5 minutes just to check on them. Or they might come and do the whole trach care and suctioning for you. Kind of depends, I feel like, on how critical the patient is. But yes, they can do trach care, trach suctioning, nasopharyngeal suctioning. They're a great resource, you guys, too. Like, if you have a question about a trach, like, I feel like they have good experience with trachs more than a lot of nurses. So they're a great resource. You should call them. I mean, I don't want to get into, like, there's different, I don't even want to get, there's like different kinds of trachs. There's called fenestrated, non-fenestrated, cuffed, non-cuffed. All depends on whether or not an event, whether they eat, whether they can talk, things like that. I feel like if you have a patient with a trach, you should learn what type of trach they have and then learn about it. Fenestrated has a hole in it so people can talk, because air will pass over the vocal cords, but it's fenestrated, they can't eat with a fenestrated, you have to take the fenestration one out and put a regular one in, it gets a little complicated. You should know the basics. I feel like NCLEX is not gonna ask them about fenestrated, but if you have questions, you can ask me, because I feel like I've taken care of a good amount of people with trachs. And stable vent patients. All right, so now you can practice.